Are you tired of waking up multiple times at night just to use the bathroom? Struggling with weak flow, urgency, or that constant feeling like you didn't empty your bladder completely? What if the solution wasn't a pill or surgery, but just a few simple changes to your daily routine? In this video, we reveal easy, science-backed habits that can help shrink your enlarged prostate and give you better bladder control naturally. From what you drink, to how you move, to the time you go to bed, these small steps can lead to big relief. Stay tuned because your new life of comfort and control starts right here. First, we have manage blood sugar levels. High blood sugar doesn't just affect people with diabetes. It can silently damage various organs in your body, including the prostate. When blood sugar levels remain elevated for long periods, it causes chronic inflammation. And inflammation is one of the key reasons behind an enlarged prostate, also known as benign prostatic hyperplasia, BPH. This inflammation leads to swelling and pressure around the urinary tract, making it harder for urine to pass and increasing the urge to pee, especially at night. By controlling your blood sugar levels, you reduce systemic inflammation, which helps relieve the pressure on the prostate and restore better urinary flow. Insulin resistance, often seen in people with high blood sugar, can also contribute to hormonal imbalances in the body. When insulin doesn't work properly, it can affect the levels of testosterone and estrogen. And when estrogen levels rise and testosterone drops, the prostate starts to enlarge. This imbalance fuels the growth of prostate tissue, leading to more frequent urination, a weaker stream, and incomplete bladder emptying. Managing blood sugar helps restore hormonal balance, which plays a key role in slowing or even reversing prostate enlargement. Another way blood sugar management helps the prostate is by improving circulation. High blood sugar damages blood vessels and reduces blood flow, which limits the amount of oxygen and nutrients reaching the prostate. A poorly nourished prostate becomes more vulnerable to stress, inflammation, and abnormal growth. But when blood sugar is controlled, blood vessels work better, circulation improves, and the prostate receives what it needs to stay healthy and function properly. High blood sugar is also linked with weight gain and belly fat, both of which can worsen prostate problems. Excess belly fat increases estrogen production, raises inflammation, and puts more pressure on the bladder and pelvic organs. This combination makes prostate symptoms worse. Managing blood sugar usually leads to weight loss, especially in the midsection, which reduces pressure on the bladder and supports prostate health. Even a small drop in belly fat can lead to noticeable improvement in urinary symptoms. There's a direct link between poor metabolic health and BPH. Men with metabolic syndrome, characterized by high blood sugar, high cholesterol, and belly fat, are more likely to experience severe prostate enlargement and overactive bladder. But studies show that men who improve their blood sugar levels through diet, exercise, and stress management experience a significant reduction in prostate size and nighttime urination. The reason is simple. Better metabolic health means less strain on the entire urinary system. Stabilizing blood sugar also affects bladder control. When your sugar levels are too high, it can irritate the bladder, increase urine production, and even damage the nerves that control bladder function. This leads to urgency, frequent urination, and even leakage. But once blood sugar is brought under control, the bladder relaxes, nerve signals improve, and you're able to hold urine longer without discomfort or accidents. For many men, this is a life-changing improvement. Diet plays a powerful role in both blood sugar and prostate health. Eating low glycemic foods like leafy greens, whole grains, berries, nuts, and lean proteins can keep your sugar stable and reduce inflammation at the same time. Avoiding refined carbs, sugary drinks, and processed foods helps prevent insulin spikes and keeps your hormones balanced. A healthy plate is one of the most effective medicines for your prostate, and it starts working within days. Exercise is another powerful tool. Regular physical activity improves insulin sensitivity, burns belly fat, and boosts circulation. It also helps regulate hormones and flush toxins from the pelvic area. Just 30 minutes a day of walking, cycling, or swimming can make a big difference. And the best part? It also improves mood and sleep, two factors that indirectly support prostate healing by lowering stress and inflammation. Next, we have limit caffeine. Caffeine might give you an energy boost in the morning, but when it comes to prostate health, it can be a hidden enemy. Excessive caffeine intake can irritate the bladder and increase the frequency and urgency of urination, especially in men with an enlarged prostate. Caffeine is a natural diuretic, which means it stimulates the kidneys to produce more urine. This added pressure can worsen symptoms of benign prostatic hyperplasia, BPH, by making you feel like you need to pee all the time, even if there's only a small amount in your bladder. By limiting caffeine, you reduce this overstimulation and help your bladder function more calmly and steadily. When you consume too much caffeine, especially from coffee, energy drinks, or sodas, it can tighten the muscles around the neck of the bladder and prostate. This tightening makes it more difficult for urine to pass, leading to a weak stream, hesitation, or a feeling of incomplete emptying. These are classic signs of prostate enlargement. Reducing caffeine intake helps relax these muscles, allowing for smoother urine flow and reducing discomfort. It's a simple but effective change that can provide relief without medication or surgery. Caffeine also stimulates the nervous system, which can trigger bladder spasms and create an overactive bladder response. This can lead to sudden urges to urinate and even occasional leakage in some men. By cutting back on caffeine, you calm this nervous system stimulation and give your bladder more control. The result is fewer interruptions during the day, fewer nighttime trips to the bathroom, and better overall bladder stability. One of the main goals of managing an enlarged prostate is reducing inflammation. Chronic inflammation plays a major role in the swelling of the prostate gland. Caffeine, especially in high doses, can raise cortisol levels, the stress hormone, and contribute to systemic inflammation. When you lower your caffeine intake, you reduce the internal stress response and allow your body's natural healing processes to kick in. Less inflammation means less pressure on the urethra and better urinary function. Sleep is another factor that often gets disrupted by both prostate issues and caffeine. Drinking caffeine in the afternoon or evening can interfere with your ability to get deep, restful sleep. Poor sleep has been linked to hormone imbalance, weight gain, and increased inflammation, all of which can make prostate symptoms worse. By avoiding caffeine later in the day or cutting back altogether, you improve your sleep quality, which supports hormone regulation and gives your body time to repair and heal during the night. Limiting caffeine also helps stabilize your hormone levels. Caffeine can affect the adrenal glands and disrupt the balance of testosterone and estrogen in men. An imbalance in these hormones is a known contributor to prostate enlargement. By keeping caffeine in check, you protect your hormonal system from unnecessary spikes and crashes, which helps slow the growth of the prostate and reduce symptoms over time. It's a subtle shift, but over weeks and months, it can make a noticeable difference. Another benefit of reducing caffeine is lower blood pressure and improved circulation. Caffeine can constrict blood vessels and temporarily raise blood pressure, which limits the flow of oxygen and nutrients to the pelvic organs, including the prostate. Healthy blood flow is essential for tissue repair and hormone delivery. When circulation improves due to less caffeine, the prostate can function more normally, and the tissues can stay healthy and less swollen. Next we have, get regular sleep. Getting regular sleep might seem unrelated to prostate health, but it plays a crucial role in reducing inflammation, balancing hormones, and supporting the overall healing of the body, including the prostate gland. When you don't sleep well, your body enters a state of chronic stress, and that stress triggers inflammation throughout the body. Since an enlarged prostate is heavily linked to inflammation, this makes the condition worse. By getting consistent and restful sleep, your body has the chance to calm inflammation, repair tissues, and regulate the systems that keep your prostate in check. During deep sleep, your body produces important hormones like melatonin and growth hormone. Melatonin isn't just for helping you sleep, It also has powerful antioxidant and anti-inflammatory effects. It supports immune function and helps reduce the oxidative stress that causes swelling in the prostate. If you stay up late or your sleep is broken, you produce less melatonin, which increases the chances of your prostate remaining inflamed and irritated. But when you follow a regular sleep schedule, your hormone levels stay balanced, and your prostate benefits from that natural repair process. Sleep also directly influences testosterone levels. Low testosterone is linked with a greater risk of prostate enlargement. If you're not sleeping well, your body produces less testosterone and more cortisol, the stress hormone. High cortisol and low testosterone create the perfect storm for prostate issues to get worse. But when you get enough deep and uninterrupted sleep, your body has the right conditions to produce optimal levels of testosterone, which helps slow the growth of the prostate and improve urinary symptoms. Bladder control is also closely tied to sleep patterns. Irregular sleep can confuse your body's circadian rhythm, the internal clock that tells your organs when to rest and when to be active. When that rhythm is off, your bladder becomes more active at night, waking you up repeatedly to urinate. That repeated nighttime urination is known as nocturia, and it's a common complaint among men with prostate problems. Regular sleep helps synchronize your body clock, reduces unnecessary bladder activity at night, and improves your ability to sleep through the night without interruption. Good sleep supports your nervous system, which is essential for proper bladder signaling. When you're sleep-deprived, your nerves become more sensitive and reactive. This increases the urgency to urinate, even when your bladder isn't full. But when you sleep well, your nerves become more balanced, and your brain receives clearer messages about when your bladder actually needs to empty. This improved communication helps you hold urine longer and reduces the frequency of urination throughout the day and night. Another way sleep helps is by supporting a healthy immune system. Your immune cells are most active during sleep, especially deep sleep. They work to repair inflammation, fight off infections, and regulate the growth of cells in your body. A strong immune system can help keep abnormal prostate growth in check and prevent complications that arise from chronic inflammation. Skipping sleep weakens this repair process and allows the inflammation to continue unchecked, worsening the condition over time. Poor sleep is also associated with weight gain and insulin resistance, both of which are closely tied to prostate problems. Men who don't sleep enough are more likely to gain belly fat and develop metabolic issues. These changes can raise estrogen levels and lower testosterone, a hormonal shift that contributes to prostate enlargement. Getting 7 to 9 hours of consistent sleep helps regulate blood sugar, control appetite hormones, and maintain a healthy weight, all factors that support prostate health and bladder control. When your sleep improves, so does your energy, mood, and ability to handle stress. Chronic stress increases cortisol, which, as mentioned before, can enlarge the prostate and irritate the bladder. But with proper sleep, your body handles stress more effectively, reducing the hormonal imbalances and tension that make prostate symptoms worse. Even your pelvic muscles become more relaxed and responsive with better rest, making it easier to urinate and empty your bladder fully. Next, we have exercise regularly. Regular exercise is one of the most powerful natural remedies for an enlarged prostate. It doesn't just help you stay fit, it directly impacts the hormones, inflammation, and circulation involved in prostate health. When you engage in consistent physical activity, your body reduces levels of inflammatory markers that are often found in men with benign prostatic hyperplasia, BPH. This reduction in inflammation can lead to a decrease in the size of the prostate over time, easing the pressure it places on the bladder and urethra and improving urinary flow. One of the key benefits of exercise is its effect on hormone balance. Many men with enlarged prostates have lower levels of testosterone and higher levels of estrogen. Regular physical activity, especially resistance training and aerobic exercise, helps boost testosterone production while lowering excess estrogen. This balance is essential for maintaining a healthy prostate size. By stabilizing your hormone levels naturally through exercise, You create an internal environment where the prostate is less likely to grow and cause urinary problems. Exercise also plays a vital role in improving blood circulation throughout the body, including the pelvic region. Better circulation ensures that the prostate receives a steady supply of oxygen and nutrients, while flushing out toxins and waste products that can lead to inflammation and swelling. Cardiovascular exercises like walking, swimming, or cycling improve the health of blood vessels, reduce stiffness, and allow for better oxygen delivery to all organs, including the prostate. This improved blood flow helps the prostate heal and stay in a healthier state. Weight management is another major factor in prostate health, and exercise is one of the best tools for maintaining a healthy weight. Excess belly fat is strongly linked to a higher risk of prostate enlargement. That's because abdominal fat increases inflammation and leads to insulin resistance, both of which contribute to prostate growth. When you lose even a small amount of weight through regular exercise, especially from the midsection, you reduce pressure on the bladder and prostate and ease urinary symptoms like urgency and frequency. Bladder control also improves significantly with regular movement. Exercise strengthens the pelvic floor muscles, which play a direct role in bladder function. Stronger pelvic muscles mean better support for the bladder and urethra, which helps reduce leaks, improve urine flow, and prevent that constant feeling of needing to go. Simple exercises like walking, yoga, and Kegel movements can dramatically improve muscle tone in this area and give you more control over your bladder. Physical activity also reduces stress, which is often an overlooked factor in prostate health. When you're stressed, your body produces cortisol, a hormone that not only increases inflammation but also disrupts hormone balance. Chronic stress can make prostate symptoms worse, leading to more frequent urination and nighttime trips to the bathroom. Exercise is a natural stress reliever. It helps regulate cortisol levels, calms the nervous system, and promotes relaxation, all of which are beneficial for the prostate and bladder. Sleep quality often improves with regular physical activity, and better sleep has a ripple effect on prostate health. When you sleep deeply, your body restores hormone levels, reduces inflammation, and supports immune function. Better sleep means better testosterone production and lower estrogen levels, which helps shrink an enlarged prostate. And since poor sleep often worsens nighttime urination, exercising during the day can help reduce how many times you wake up at night to use the bathroom. Another important benefit of exercise is improved insulin sensitivity. High insulin levels are associated with a higher risk of BPH, and many men with prostate problems also have issues with blood sugar regulation. Regular exercise lowers blood sugar and helps your cells respond better to insulin, reducing one of the root causes of prostate swelling. This metabolic improvement also supports healthy weight, lowers inflammation, and strengthens overall bladder function. Exercise doesn't need to be intense to be effective. Even moderate activity like brisk walking for 30 minutes a day can bring noticeable improvements. The key is consistency. Regular movement trains your body to function better, your hormones to balance more efficiently, and your immune system to work in your favor. Over time, this leads to a prostate that's less inflamed, a bladder that functions more smoothly, and a life that's no longer interrupted by frequent trips to the bathroom. Last, we have drink plenty of water. Drinking plenty of water might sound like a simple habit, but it has a powerful impact on prostate health and bladder control. When you stay well hydrated, your body can flush out toxins more effectively, which reduces inflammation, a key factor behind an enlarged prostate. Chronic dehydration leads to concentrated urine, which can irritate the bladder lining and make urinary symptoms worse. By drinking enough water daily, you keep your urine diluted, soothing the bladder and reducing pressure and discomfort caused by an enlarged prostate. Many men with prostate issues try to avoid drinking water to reduce the number of bathroom trips, but this actually backfires. When you don't drink enough fluids, your urine becomes more acidic and irritating. This can lead to inflammation in both the bladder and the urethra, increasing the urge to urinate and making symptoms of benign prostatic hyperplasia, BPH, even worse. Drinking adequate water helps prevent this irritation and promotes a more relaxed and stable urinary system. Proper hydration also supports the kidneys, which play a key role in filtering waste and maintaining the balance of fluids and electrolytes in your body. When the kidneys function efficiently, there's less buildup of waste that could contribute to inflammation. This clean internal environment allows the prostate to stay healthier and less prone to swelling. Water also helps transport essential nutrients throughout the body, ensuring the prostate receives what it needs to function optimally. Staying hydrated aids in hormonal balance as well. Your body depends on proper hydration for every metabolic process, including hormone production and regulation. Hormones like testosterone and estrogen directly influence prostate size and health. When you're dehydrated, your body's systems become strained and imbalanced, potentially increasing the risk of prostate enlargement. Drinking enough water ensures your hormonal system stays stable, which helps prevent and manage prostate-related issues. One overlooked benefit of drinking more water is improved bladder training. When you drink fluids consistently throughout the day, your bladder gets used to holding and releasing urine in a more predictable way. This trains the muscles and nerves involved in urination to work more efficiently. Over time, this can improve your bladder control, reduce urgency, and help empty your bladder more completely, problems that often come with an enlarged prostate. Water intake also supports weight management, which is closely linked to prostate health. Drinking water before meals can reduce hunger and prevent overeating. Maintaining a healthy weight reduces inflammation, balances hormones, and lessens the pressure on your pelvic organs. Excess weight, particularly around the belly, is associated with more severe BPH symptoms. Hydration indirectly contributes to shrinking the prostate by supporting these weight-related improvements. Another way water helps is by preventing urinary tract infections, UTIs, which are more common in men with BPH due to incomplete bladder emptying. UTIs cause additional inflammation and irritation in the urinary tract, which worsens prostate symptoms. Drinking enough water flushes bacteria out of the urinary system before they can multiply and cause an infection. A cleaner urinary tract means less inflammation and fewer complications for your prostate. Hydration also boosts your body's natural detoxification systems. Your liver and lymphatic system work alongside your kidneys to eliminate toxins. When you're properly hydrated, these systems function better, reducing the overall toxic burden on the body. Since toxins can contribute to inflammation and hormone disruption, flushing them out with water can have a calming effect on the prostate. This supports the gland's health and helps prevent further enlargement. For men who suffer from frequent nighttime urination, the timing of water intake is also important. Drinking plenty of water earlier in the day and tapering off in the evening allows you to stay hydrated without overloading the bladder at night. This simple adjustment can improve sleep, reduce nighttime urgency, and allow the bladder and prostate time to rest and heal during the night.